Assalamualaikum warahmatullahi wabarakatuh to our beloved lecturer and to our fellow friends. Do you ever wonder that becoming parents is one of the dreams too? Not everyone has the desires of becoming a parent, but for those who want, being unable to conceive a child is a painful reality. If the failures to conceive occur, it will be a major stressor for couples who really have desires to get their own child. Most people don't take this problem seriously because they don't know that this problem is related to infertility. According to the World Health Organization, the clinical definition of infertility is a disease of the reproductive system that is caused by the failure to achieve a clinical pregnancy or inability of a sexually active person after a year or more of usual unprotected sexual intercourse. Infertility is a significant and common problem for both men and women. As men, infertility is responsible for 20 to 30% of infertility cases, while 20 to 35% are due to women infertility. Even though tremendous steps have been made in treating this relatively risk condition, in order to overcome this problem, infertility is typically not openly discussed. So, our thesis statement for today is, there are several infertility risk factors for men and women, such as menstrual disorder problem, the effects of chemotherapy treatment, and the usage of tobacco and alcohol.
Menstrual or ovulationary disorder problems are one of the most common leading factors of infertility, especially in women. Ovulation disorder are a spectrum of condition in which it affects the woman's endocrine system, which control the hormone and the pattern of ovulation, as the hormone regulate the menstrual cycle and the ovulations. According to an article stated by the World Health Organization (WHO), ovulation disorder are the cause of infertility in around 25% of couples who have difficulty conceiving. Abnormal ovulation, or also known as anovulation, means that the failure of ovary to release eggs over a period of time generally exceeding 3 months is often the underlying causes of irregular periods. The normal functioning ovary release the eggs is between 25 to 28 days. Having irregular periods and menstrual disorder problem are conditions that disrupt normal menstrual cycle in women include amenorrhea, which is lack of menstruations, oligomenorrhea, which is infrequent periods, and menorrhagia, which is prolong of heavy periods. Irregular ovulation can be caused due to many issues due to an imbalance of luteinizing hormone LH and follicle stimulating hormone FSH and an injury to the hypothalamus or pituitary gland. For ovulation to occur, a part of the brain called a hypothalamus prompts the nearby pituitary gland to secrete hormone that trigger the ovary to ripen eggs. Other hormonal conditions that can affect fertility include thyroid problem, diabetes, underweight, obesity, polycystic ovary syndrome (PCOS), and premature ovarian failure (POF). Apart from this, women's age is one of the factors which is also a significant factor in fertility rates. Pregnancy opportunities for women over the age of 40 are only 5% per menstrual cycle. Aging age are considered the cause of the decline in the percentage of pregnancies at that age.
The other factors that can affect infertility is chemotherapy treatment. What is chemotherapy treatment? Chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in the body. Chemotherapy is most often used to treat cancers, since cancer cells grow and multiply much more quickly than most cells in the body. Many different chemotherapy drugs are available. Chemotherapy drugs can be used alone or in combination to treat a wide variety of cancer. Though chemotherapy is an effective way to treat many types of cancer, chemotherapy treatment also carries a risk of side effects such as infertility. Some chemotherapy drugs are more likely than others to cause infertility. Whether your infertility is temporary or permanent, it depends on your drugs and dose. According to the Turan and Octet 2014, for women, chemotherapy, especially alkylating agent, can affect the ovaries, causing them to stop releasing egg and estrogen. This is called primary ovarian insufficiency or POI. What is alkylating agent? Alkylating agents are drugs that damage the DNA of cancer cells to keep them from making more copies of themselves. They are the oldest type of chemotherapy. Alkylating agents treat many different types of cancer, such as leukemia, lymphoma, Hodgkin disease, as well as breast, lung, and ovarian cancers. Sometimes POI is temporary and your menstrual periods and fertility return after treatment. This happens in about a third of all women whose periods stop because of chemotherapy. It takes about 6 to 12 months for your period to go back to normal. Other times, damage to your ovaries are permanent and fertility does not return. Chemotherapy can also lower the number of healthy eggs in the ovaries. Women who are closer to the age of natural menopause may have greater risk of infertility. Besides, for men, not all chemotherapy drugs affect your ability to having a child, but some drugs can reduce the number of sperms and their motility to fertilize an egg. Chemotherapy drugs also can affect the nerve in the genital area. This can make it difficult to get or maintain an erection, and it can affect ejaculation process. Fertility problems from cancer treatment may be temporary or permanent. Some men regain the ability to produce sperms after treatment. This generally takes 1 to 3 years, but can sometimes take longer. Some men have an only partial recovery with low sperm counts, and some men never recover sperm production.
Hi, Assalamualaikum warahmatullahi wabarakatuh. I am Zainey Azneyra binti Zainudin. Today, I would like to talk about how tobacco and alcohol affect infertility in both men and women. Before we go into deeper discussion, let us see what is actually tobacco and what is actually alcohol. So, tobacco is a plant grown for its leaves, which are dried and fermented before being put in tobacco product. Tobacco contains nicotine, an ingredient that can lead to addiction, which is why so many people who use tobacco find it so difficult to quit. There are so many other potentially harmful chemicals found in tobacco or created by burning it. And how about alcohol? Alcohol is a drug. It is classified as a depressant, which means it slows down vital function, resulting in slurred speech, unsteady movement, disturbed perception, and inability to react quickly. As how it affects the mind, it is best understood as a drug that reduces a person's ability to think rationally and distort his or her judgment. So, our topic for today is infertility risk factor in men and women. The usage of tobacco and alcohol is also one of the infertility risk factor for both men and women. Tobacco and alcohol have a range of short and long-term health effects for both men and women. Alcohol has been shown to affect male and female infertility, but the level of consumption associated with the risk of alcohol is unclear. Women who abuse alcohol are having low chances of becoming pregnant. In men, alcohol can affect fertility by altering sperm count, shape, and motility. Heavy drinking can reduce female fertility by interrupting menstrual cycle and ovulation, causing some changes to ovarian function, known as amenorrhea and anovulation. Besides, alcohol also will change the hormone level of testosterone, estradiol, and luteinizing hormone. In men, heavy drinking affects fertility by lowering testosterone level, shrinking the testes, causing early ejaculation, and changing the shape, size, and movement of healthy sperm. Chemicals such as nicotine, cyanide, and carbon monoxide in cigarette smoke speed up the loss of egg. Furthermore, maternal smoking will also increase the risk of low birth weight and birth defect, and women who smoke reach menopause earlier than non-smokers. Heavy smokers by fathers at the time of conception increase the child's risk of childhood leukemia and shorten the reproductive lifespan of the daughter. Male smokers can suffer decrease of sperm quality with lower count and motility of increased number of abnormally shaped sperm. According to an article, more than 1/3 of male adults worldwide who use tobacco and approximately 30% of women of reproductive age smoke cigarettes. So that's all from me for today. Thank you for watching.
To conclude, both men and women can contribute infertility problems. They need to be aware of the risk factors that may cause them to get infertility problems. The risk factors were exposed to ensure that people who are experiencing the infertility problems can be remedied and seek timely medical intervention. To the people who face the infertility problems, they need to seek the doctors for help immediately at any time and never be shy to talk and discuss about this issue. Early diagnosis of an infertility problem may improve health and increase the productivity of the patients. To prevent the infertility problems, several infertility risk factors for men and women need to be taken seriously, such as menstrual disorder problem, the effect of chemotherapy treatment, and the usage of tobacco and alcohol. That's all for our presentation today. If you have any question, don't hesitate to ask at the comment section below. Thank you.